Hi to everyone. I hope you can hear me. Welcome to our deep dive, community engagement voices from the community, organized by the Risk Communication and Community Engagement subgroup for refugees, IDPs, migrants, and host communities particularly vulnerable to the COVID-19 pandemic, organized by UNHCR, UNICEF, and IOM. My name is Catherine Harris, and I work for UNHCR. Next slide, please. So today, the deep dive, we will concentrate most of the time hearing from some different members of communities that have been involved in the response to COVID. To start, I will give the welcome now, then we'll have introductory remarks from Noreen from UNICEF. We will then go into the panel presentations. We have Ms. Marilyn, the Secretary of the Malaysian Karen Organization in Malaysia, in Kuala Lumpur. We have Ms. Asma Ismail, Secretary of the Camp Management Committee in Jamale IDP site. We have Mrs. Refa Faiz Al-Rafai, the General Manager and Co-founder of Sorania, in Egypt. And we have Mr. Ian So, representative of the More Than Viral Than the Virus, a global COVID youth movement. Following their presentations, we will invite all the participants for some discussion. We have some questions to consider and would really encourage everyone's involvement. And then we have the wrap up by Carlos Van der Laat from IOM. Next slide. We've talked a lot about risk communication and community engagement since the onset of the COVID pandemic. And we know it's really critical to communicate to the public what is known about COVID-19, what is unknown, what is being done, and actions to be taken on a regular basis. And it's really important that any activities should be conducted in a participatory, community-based way that are informed by community feedback and optimized to detect and respond to concerns, rumors, and misinformation. Again, it needs to be responsive, empathetic, transparent, and consistent messaging in local languages through trusted channels of communication using community-based networks and key influencers and building capacity of local entities. So we've been trying to do this, the humanitarian community, for several months now, and we thought it was a good opportunity to take some time to reflect and to see how we've been doing and maybe to learn best practices, but also where we can improve. So now I'm going to hand over to Miss Noreen Nadi, who will give a few introductory remarks. Thanks.
Hi, everyone, and good morning from New York. I'm Noreen Naqvi, and I'm really fortunate to be working with UNHCR and IOM on this really important population. Today is a really important day for us because it's just going to be a really learning opportunity for us to learn from the people who are serving these communities, who are working with these communities, who are from the kinds of groups that we are talking about, and also a youth champion. I would like everyone to just step back a little bit and think about the situation. And let me give you some data around what's going on around the world right now. So today that we have over 38 million infections across the globe. So there are more than 5,000 deaths every day. So more than 5,000 people are still dying every single day as we speak. Going to Syria, a country like Syria, the cases remain low, but we do understand that there is limited testing. And we also further understand that there might even be limited testing among the refugees and migrants and vulnerable populations. We go to Somalia, and then we know that there is a complex crisis going on. It's a very fragile health system. And then security risk. There is food insecurity as well in Somalia. We go to Venezuela from there, and then we know how the pre-existing economic crisis is further aggravating because of COVID. And of course, it has a huge impact on the population that we are talking about today. The most important and critical thing is there is disruption of essential health services. It means immunization and other health services. Around 56% of measles campaigns in 27 countries remain postponed. And that puts 105 million children at risk. And many of them are in the among the refugees and migrants. I would also like to bring your attention to some more facts that, among the most at-risk population that we are talking about today, 17% of country offices, according to one survey that UNICEF has just done, report a drop coverage of health services for displaced and refugees. It's an alarm for us. In 59 countries, refugees and asylum seekers are not covered under new expanded government social protection measures. And then stigma and xenophobia exists. So with all this, I would like us to really think about what is it that is happening right now. Of course, there are some really wonderful examples, we know that, and that's why some of the colleagues are here today to talk to us directly. But then we need to also think about, at the end of this year, what is it that we need to now do further? What is it that we need to strengthen? Where do we need to pay more attention, and how we could support you better as a global team of partners. So with that, I am going to really hand over the floor back to Catherine, you and the panelists, to really think about all this, and then give us your thoughts, give us your ideas. What is it that you're doing, and how do you want things to be better for refugees, migrants, and vulnerable populations? Over to you, Catherine.
Thank you so much, Noreen. So let's jump straight into it. And first, I would like to introduce Ms. Marilyn. She is the secretary of the Malaysian Karen organization in Kuala Lumpur, Malaysia, and has worked a lot with the different refugee and asylum seeker populations in Malaysia. Ms. Marilyn, over to you.
Hi, yes, a very good evening from Malaysia to all of you from different parts of the world. Thank you for being with us. Thank you for your time. And my name is Marilyn. I represent Malaysia Karen Organization, a Karen minority ethnic community from Myanmar. And my community office is representing for a Karen population in Malaysia and providing services for about 3,000, 4,000 community members when they have problems and issues related to health, education, arrest and detention, livelihoods and employment issues. As a representative for the community, my work is also extended to work with two other coalitions called CUBEN, Coalition of Burma Ethnic Malaysia, and MURO, Myanmar Ethnic Women Refugee Organization. First of all, I want to thank the team to organizing this, and also I want to thank you for giving me this chance to share about my experience Before sharing my experience, I want to let the audience know that all my sharings for this experience, for this discussion, is based on my experience working with my community, particularly because there are many other refugees and migrant communities in Malaysia, and each community's strength, structure, approaches in responding to COVID-19 can be very different or similar to what I did for my community. Earlier this year, when the pandemic started, many community, including my community, get hit by the virus, and we were in the midst of fighting against COVID and struggling in helping our community members. And the first thing my team and I noticed was that demographically, our community members are scattered all over the country. And the question is, especially during the pandemic, how do we keep them all in order for us to provide a better and effective services? How do we keep them updated with information at the same time to keep them connected to each other and sharing their problems and issues despite the movement restrictions orders? At this point, I want to highlight that the fact that working as a team collectively play an important role in creating effective advocacy effort. It's really amazing how local communities are collaborating with NGOs and helping refugees and migrant communities. And within refugees and migrant community, we are working hand in hand. And also, I want to really appreciate each and every team member from my office for their tireless commitment for the community. Besides getting all the support locally, we are also working with our community out of Malaysia, our current community in Australia, and especially Australia and in the US. And we get tremendous amount of support that get us through this difficult situation. Before the pandemic, for information sharing, we reach out to the community member by going on community outreach trips every month and to share information about the current situation to rural area where members are working and staying. Mapping out my community with a very basic survey form helped us with a great insight of understanding the community's population needs and emerging issues. But during the pandemic, meeting in person with our community member face to face is not really possible. So we have to rely 100% on social media platform to communicate constantly, to share information about COVID and also other situation and other information about the current situation. So we are using Facebook, Messenger, WhatsApp groups, and also we have to make sure that we call some of the individual community member, because certain percentage in my communities are elderly who have very little knowledge with technology. So in that way, we make sure member gets correct information they needed. As to make sure correct information, we are following all the information sources from WHO and also Health Ministry of Malaysia. We get adequate amount of information from local and international organizations, including UNHCR Malaysia, and very basic steps and simple way of protecting yourself, especially for community member to take precaution individually. And after all, following all the recommendation for public health is the most effective way to protect yourself and also protecting the community that you are living in. And I personally think that it's even effective when the information about COVID-19 is translated into different languages. So throughout the pandemic, some of the issues and concerns really stand out and draw our attention. The first one and most important one is mental well-being of the community member, as many have lost their jobs and become unemployed and subsequently affecting their life in so many different ways. But the most recent ones are not being able to pay out rent, not being able to get a job, not being able to support the family, and not knowing of how to move on with their life uh, in a positive way. So it is really important for us to keep sending out positive information, positive notes while we are sending about the virus information, while we are sharing the information about COVID-19. There are reported committed suicide cases going on in community in Malaysia, and uh, that is something which is really serious, and we cannot really ignore the fact that our community members are in need of psychosocial support. And members' biggest fears is not only the virus, but also their livelihoods in the long run. So we have to make sure that we send out the positive information to make them feel make them feel safe, make them feel not being left out, make them feel that they are not facing the problems on their own alone, and we will always be there while we are taking care of ourselves and focusing ourselves to mentally prepare to help our community member. On another note, the second issue, an important one, is education for children and youth in our community is really critical, since they only get informal education from community-based school, and now that school are not fully operated, students are going for online classes, but then the concentration level is not there. So we need more innovative way of creating education program consistent classroom like they were before. So basically, many people are in need and many people are in the house at the same time, and the anxiety is growing in the household. So with that being said, we need to let the community in reality that the virus will stay with us and the virus won't go that easily unless we get a vaccine soon. Then we can move on. The virus is holding back us from many things, but on our part, instead of thinking and worrying of what next coming, what to come next, and we have to start preparing and focusing on community sustainable programs for the long term with the help of local and international organizations, a more innovative way of mapping out our community in the future to empower and advocate them. Last but not least, for all the marginalized community in Malaysia in this current challenging situation, we are in need of financial support, and we are in need of coming up with different programs to sustain not only for the community but also for the community offices. So I really hope that my sharing about my community will somehow bring you a better understanding, and also this is your chance to support us and to explore more on refugee community and migrant communities in Malaysia, and I hope this sharing is giving you a realization of resilience and struggles of my community and many others in Malaysia. Thank you.
Thank you so much, Marilyn. And yes, it did. You've really articulated really well the challenges that you faced trying to support the community in this really difficult time. And I think really highlighted the importance of knowing the community and knowing the different priorities of the community to try and address them all together. And thank you so much for sharing. And I hope we'll hear from you again when we get some questions, because I think there's a lot that you have to share. Thank you. So now I'll hand over, thanks. So now I'll hand over to Asma Ismail. She is Secretary of Camp Management Committee in Jamali IDP site. Asma will be speaking in Somali, and it will be translated by Mr. Khader, who works for NRC. Thanks very much. Asma, Khader, are you there? We can't hear you. There we go.
Sorry, we were mute.
Perfect. Please go ahead.
waxaan deganahay saaska NDP-ga magaalada Jimcaale NDP camp. waxaan ahay hooyo haysataa 6 caruura, sidoo kalena daryeesha aabaheeda xanuunsanaya. waxaanan ka mid ahay xubnaha guddida xaafadda magaalada Jimcaale barakacayaasha.
Yes, Asma is saying, my name is Asma Ismail Mohammed. I'm from Jimcaale IDP settlement, Hargeisa. I am a mother with 6 children. I also care my father who is mental ill. I am a community mobilizer, and also I am the secretary of the community committee in Jimcaale IDP settlement.
waxaana loo qabtay tababaro kala duwan ay noo qabteen hay'adaha kuwa localka iyo kuwa internationalkaaba sida xalinta khilaafaadka qaabka wacyigelinta loo sameeyo iyo xaaladaha konflikta.
So far, I have benefited trainings from international organization in Hargeisa. I was trained as a community mobilizer, particularly women and child community mobilizer. I have also attended extra trainings, including local conflict resolution trainings and child protection and safeguarding trainings.
Sorry to interrupt. Sorry, Asma, to interrupt. Khada, when you are translating, can you just speak a little closer to the microphone? We're having a little bit of trouble picking up what you're saying. Thank you.
Okay.
Sorry.
Okay.
sidoo kale waxaan ahay community mobilizer. waxaan ka shaqeynaya wacyigelinta muddo 5 sano NDP-ga aan deganahay. wacyigelinada qabanayay waxaa ka mid ah sida naasnuujinta iyo daryeelka ilmaha yar, wacyigelinta COVID-19-ka, wacyigelinta taxadiyada dhanka carruurta iyo haweenka. sidoo kale waxaan bulshada aan la waday oon u sameynaya wacyigelin dhanka ah taxadiyada reebka iyo xirmada.
So I was as a community mobilizer in 5 years now. So before I was participating in community awareness sessions, including.
Sorry, Khada, I'm sorry. We still cannot hear you properly. Sorry.
Yeah. Okay. Sorry. Can
That's
you hear
better.
me
That's
now?
better. Yes, that's better.
Yes.
Thanks.
So she said I was participated as in my role as a community mobilizer. My role is to mobilize the community, and my tasks was included to do awareness raising sessions on breastfeeding, child protection and safeguarding, and later on COVID-19 and prevention issues.
intii aan ku guda jiray muddadii aan wacyigelinta waday intii lagu jiray muddada coronavirus-ka waxaa u kacday waxyaalo fara badan sida qodobaano kala sameeya. qodobka koowaad wuxuu ahaa inay kor u kacday inay hoos u dhacday shaqooyinkii ay qaban jireen dadka muruqmaalkii oo ay xirmeen. sidoo kale inay iskuuladii xirmeen oo waxbarashada carruurta ka istaagtay. sidoo kale inay kor u kacday tirada carruurta lagu sameynayay gudniinka fircooniga. sidoo kale inay kor u kacday xaaladihii tacadiyada dhanka haweenka iyo gabdhaha kufsigii intii lagu jiray coronavirus-ka maadaama ay carruurtu fasax ahaayeen. muddadii lagu jiray coronavirus-ka wuxuu kor u kiciyey in hooyooyinkii iyo aabbayaashii markii ay kasoo fadhiisteen shaqadii in guryihii laga barakiciyo oo barakicin lagu sameeyo.
COVID-19 has many consequences and effects to the community in Mahmoud and also in Hargeisa.
Khada, sorry. You need to go closer to the microphone.
Yes, she's saying COVID-19.
We're still struggling to hear you. I apologize. Try again.
Yeah, COVID-19 has consequences and effects to the community in Mahmoud IDP settlement and Hargeisa as well. And those are actually that people has lost their national libraries because most IDP population, they usually go to the markets and they do a casual work, including construction work, and women also go to the market to sell small items and also to work houses of those people, the rich people. And however, during the COVID-19 restrictions, all these small business and casual work has actually stopped, and that has affected and that all the family members, including those school who has lost also their schooling, all are staying in a small room or a small house in the IDP settlement. And in that situation, family conflict has actually increased, and forced evictions among the communities was also increasing. and FGM against young ladies was also increasing because women over there they get a time to have a time that they can actually circumstances they are not going to school, and also family disputes were also increasing, and GPV issues are actually also increasing during COVID-19 restrictions, and actually you can feel that kind of situation where I'm trying to provide an awareness raising and mobilizing communities and providing information that can help people. It's actually a very hard task. However, we are still mitigating and working on it.
markay dhaceen xaaladahaas oo dhani waxaan siinayay dadka wacyigelin ku habboon gaar ahaan markii la xidhay waxbarashada waxaa wacyigelin ku siinayay waalidiinta inay u sameeyaan carruurtoodii inay dib u eegaan casharadii lasoo dhaafay problem familiga ama khilaafaadka ka dhex dhaca qoysaskana ay ku xalliyaan sida ugu habboon ay carruurtooda tixgeliyaan shay kastaana inay ku noqon doono sidoo ahaa xarumaha iska laaban doono.
Okay, so now my role as a community mobilizer has actually 100% to be.
Sorry, Khadar, could you maybe, is it possible to move the laptop a little bit? Again, you are breaking up when we cannot hear your voice properly. Sorry. Try now.
So now, can you hear now? Can you hear me now?
Perfect. That's great.
Yes. As I say, as a community mobilizer, most of my tasks are now on COVID-19 prevention, and then we should have to provide an awareness.
No, Khadar, sorry. Are you covering the microphone? Because we cannot hear you properly.
No, I'm actually, there's no.
That's better. Stay there. That's perfect.
Yeah. So, and she's saying that we provide our awareness sessions are more on COVID-19 and prevention issues. So we provide information related, women to avoid not to circumcise their children, and also women are complaining that since children are not getting school now, and they are actually at going in different places. So then that's when gang rapes and other issues are also happening. So we actually tell women to actually make sure that their children are at the house and also not go out at night times, and that actually and making an FGM to the young girl is also very bad tradition and it's not good. And then actually that's the kind of tasks that we do. We have also experienced that since most of the people lost their small jobs and their casual work, they actually most of them they rented these new houses. So then due to that they are not paying the rent on time, and actually they were affected by the house owners and the landowners. And at that time we also do a conflict resolution among these people, and we actually try to have an extension time for the rental period, all that things. So that is actually the main tasks that we do at the IDP settlement.
waxaa ka mid ahaa challenge-yadii ama caqabadihii ugu horreeyay intii muddada aan ku jiray wacyigelinta COVID-19 inaanay bulshadu aaminsanin xanuunka way oranayeen xanuunka wuxuu ku dhacaray iyagoo keliya tan.
So one of the main challenges that we actually encounter is that people are not actually, most of the people are illiterate people, and they don't actually they don't understand what kind of disease we are talking about. So they are saying this is not for Somalis and the poor people. This actually hits to European people and the rich people. It's not for us. And it's better you didn't talk about it. So it is like a taboo when you among the community, and that is one of the big challenges we have now.
waxaan u sheegayay bulshada xanuunku uu ku dhici karo cid kasta cid muslina iyo cid reer Yurubaba waxaan siinayay tusaalayaal cadcad oo wax ku qaataan say wacyigelintaydu iyo meel gasho sidoo kale waxaan ku oranayay xanuunku wuxuu ku dhacay madaxweyne ku-xigeenka Jamhuuriyadda Somaliland gudoomiyaha xisbiga mucaaradka ee wadani ciro kadib waxay xaqiiqsanayeen fariinteeda inay tahay kaliya.
Then we should have to end up and explaining and things deeply. For instance, we provide an examples regarding that, you know, many Somali people and actually encountered this disease. For instance, I provided an examples related that the vice president of Somaliland was actually positive, and that one of the senior political leaders was also positive, and that many people in Hargeisa was actually passed away due to COVID-19. So actually some of them later on, they actually accept, listen.
waxaa kaloo caqabad waa intii wacyigelinta COVID-ka waday. Wacyigelinta waxaan u qaban jiray gruubyada samayn jiray ama qof baan ula hadli jiray. Maadaama uu jiray COVID-ku waxaan ka cabsi qabay inaan la kulmo dad bas aan COVID ka qaadaan wacyigelinta samaynaya. kadibna waxaan kala hadli jiray albaabka hortiisa. dadkuna waxay jeclaysanayeen inaan guriga u soo galo soo dhawaado. Ana halkaasaan doonayay inaan wax macluumaadka helo.
Then one of the challenges was that when I was providing the information and awareness raising sessions, I usually try and introduce you know, the COVID-19 restrictions like social distancing and wearing masks, all that things. But actually people were not very happy to do that because actually they were supposing that I am actually higher than them, that I am not actually I'm not approaching to them because I'm not actually respecting them. So actually I was trying to convincing them that social distancing is the only way that people can actually prevent themselves, and also washing hands are actually the next thing that they can actually avoid to get this disease. So later on, some of them they can convince the others they will not accept.
waxaa kaloo ku daraa caqabadihii wacyigelinta waday. dadka marka corona ku dhacay waxay taasay shaqooyinkoodii. waxay waayeen nolol maalmeedkii ay ku noolaan lahaayeen. ana waxaan u siday wacyigelin kadib waxay igu lahaayeen waxaad noo sidaa wacyigelin laakiin waxba nama siiyansid wacyigelintu waxba nooma tarayso. waxaan u baahanay waxaan isticmaalo. ana waxaan ku oranayay wax sheega ayaa ka wanaagsan waxsinta.
So majority of the people they actually complain and say, you know, all the time, Asma, and also your colleagues, you are providing an awareness raising activities here in the IDP settlement, and you are not providing anything for us. You know that we lost our jobs. You know that our children are not going to school. You know that some people are very angry, and then you are still talking. Why don't you provide some food or ration before talking? That was actually a challenge for me to convince them, and actually I should have to explain more on that. You know, people can get something to eat, but actually to have some people, those who share you what is existing and the problems of the disease, it's actually very important. So also to listen at the problems of this disease, and also to take these instructions are good for your health. So if you lost your health, you won't eat. So that please first protect yourself, and then next will be there.
wacyigelinta dadka sidoo kale la xoojiyo. dadka donorska ama hay'adaha internationalkina ay si dhab ah ula xiriiraan wacyigelin la sameeya aan xilli soo marin si loo arko waxqabadkooda.
Yeah, so me as an Asma, actually all those challenges are there in the IDP settlements. I'm also expecting that all these problems are everywhere in Somalia. So I actually request, you know, humanitarians and to go deep into the communities and actually talk to the people and know actually the real situation in the IDP settlements. Thank you.
Thank you so much, Asma, and thank you, Khada. Apologies for the difficulties we had with the sound, but thank you very much. And Noreen has said we are recording this, and we'll try to make sure that we can put into writing some of the things that Khada was translating for Asma, so that everyone can understand if you didn't quite hear it. But just Asma, thank you so much. And I think really interesting again, and it reaffirms a little bit what Marilyn was talking about. It was the importance of knowing the community and knowing how to approach them and knowing their concerns and listening to what their concerns are. Thank you so much, Asma. Next, we have Mrs. Rafa, General Manager and Co-founder of Soyana. Thank you.
Hi, my name is Sarah Mahmoud. I'm the community manager at Soyana, and this is Mr. Rifai, the co-founder and the general manager of Soyana. First of all, I want to introduce Soyana as a company. Soyana is a social enterprise that aims to help or to empower and engage youth and women in many fields such as training, workshops, and so on. We are trying to connect youth and women with suitable resources that we have in many fields such as entrepreneurship, humanitarian, and education. In Soyana, we reached approximately 40,000 trainees, and we have almost 150 staff members. We are now operating in 7 countries in the MENA region, and we work with 9 nationalities here in Egypt. Regarding the problems that we face in Soyana, we're gonna talk more about the affection of COVID-19 and what the COVID-19 affect the refugees and immigrants. We are mainly working with the refugees and immigrants here in Egypt. So I'm gonna leave the floor for Rifa.
Hi, as Soyana, we faced a lot of problems during the pandemic, and actually these problems restricted us from work with high efficiency as we used to do. Let's list these problems. First, we forced to switch all of our operations to be online. To follow the lockdown restrictions, we have to take in consideration that our work are mainly based on offline activities. Secondly, most of migrants and refugees faced problems in adapting with the technical tools, or they don't have smartphones or PCs. Third, we reported a huge increase in GBV during the lockdown. Fourth, most of the affected communities facing problems in their medical situation because they cannot cover their medical fees. The IOM helped and still helps the community, especially the affected communities, by many things. The first thing, by providing food baskets for affected communities. Secondly, by raising awareness about COVID-19, and also they delivered sessions for mental health during the pandemic. Moreover, the IOM provided workshops and trainings, tackled first aid and CPR. And last but not least, they provide to the affected communities blankets under the theme of warm Alexandria. Actually, we worked with many national and international organizations, including UN agency. We are now working on be legal partners with many other organizations to be able to help all the migrants and refugees. Thank you.
Thank you so much, Mrs. Rafa. I really appreciate your sharing and the great work that you are doing in Egypt and across the MENA region. Thank you so much. And finally, I'm going to hand over to Ian, Mr. Ian, and he is talking from More Viral Than the Virus.
Hi, everyone. Thank you, Catherine, for the wonderful introduction, and esteemed colleagues and audience for listening to my sharing. It's really an honor to be here with you today. Emphasizing Noreen's sharing earlier, more attention needs to be paid to vulnerable and marginalized groups, communities, and populations. And on that note, in my sharing today, I hope to provide some tips of how we can effectively engage communities, how do we enhance our reach, and how do we work around those challenges in doing so. So a quick introduction as to what morvirus is. At the beginning of the pandemic, morvirus was founded in response to WHO Director General Dr. Tedros' press statement to young people, warning young people that we are not invincible to the coronavirus, and highlighted that our actions has consequences, especially to the older members of our family. As medical students, I wanted to help out on the front lines. So do other medical students. But we were confronted with the unavoidable fact that we were only just medical students. Recognizing the warnings from the WHO as a problem, we were determined to find a solution. We believe that as medical students and young people, we have a social responsibility to educate our peers, other young people, of the key messages of the WHO, address the worrying attitudes of young people, correct any misinformation and disinformation among our different age groups, tackle issues related to mental health, and highlight other pertinent COVID-19 issues. So now, as you can see from my sites below, our movement has helped to address issues like misinformation, mental awareness, and worrying attitudes that some young people had adopted to the COVID-19 crisis. So I'm going to demonstrate an example of how we did it in the community and how we effectively tried with attempts to try and solve this issue of misinformation. So at the beginning of the pandemic, we understand that WHO has provided a lot of good guidance. The CDC as well in the US has provided a lot of good guidance around what COVID-19 is. But most of this information was in English. And for us, we recognize that could potentially be one of the reasons why misinformation was happening, because young people in these communities that don't speak English may not understand what exactly COVID-19 is about and how and what exactly is the right information to go about this. So as young people, as medical students, we thought that, look, let's come together and let's identify these issues within our community, because we can definitely do that. And because we can also translate. So I remembered who is this? Marilyn also mentioned about translating. This is what we did. We translated so some of these WHO guidance into the various languages of these communities. So for instance, in Mexico, which I'm going to talk about in a bit, we translated to Spanish. So with that, we basically came up with some of these really interesting graphics to catch people's attention, to catch other young people's attention, so that we can effectively communicate some of these guidance that the WHO was trying to communicate to the public. And this was how we did it. And this was prior to, in fact, the spike of cases in Mexico, which I think now the situation there is more than ever concerning. But as you can tell, even with limited funding or no funding at all, we were still able to reach out to at least about 450,000 people when we just started off, as a simple idea. And that's how we developed this along the way. And then we realized that, look, we have potential here to support other stakeholders or support other efforts and related to COVID-19. And we found the key to appealing to other young people, and we know what the interests of young people are, and I hope to share with how we did it today. So for instance, when we talk about engaging with other young people, we thought, we need to do it in a creative way, because creativity would appeal to other young people. And there are various mediums on social media, like Marilyn has mentioned. We use WhatsApp groups, we use Instagram, we use Facebook. But then there are some of these very interesting things that young people use today, which I don't know, it just catches our attention. So we use things like digital filters. So the BBC very, very kindly featured our work, whereby we just three simple things. You want people to wear a mask, you want people to social distance, you want people to say no to fake news, to misinformation. How do you do that effectively and quickly and really get people motivated? Because a lot of the time we find ourselves raising awareness but not really caring about how we about the product and how we actually drive actions. So effectively, by engaging with different young people and getting them to do different things through different mediums, through translation, with translation like what Marilyn did, we did translations, and we also made sure that we have an interactive medium that young people can use. So yeah, so this is all for this slide, and if you allow me to go on to my next slide, please. So yeah, so now I have a little secret to share with everyone, because many a times, I've always got the question of like, look, should we be producing more infographics? Should we be spamming more words into posts? Because there's so much things that we need to communicate about COVID-19. But I think through our movement, we realized that we need to break it down. And there are actually so many other interactive mediums that have existed in previous centuries, like comic strips, which I remember when I was much younger, where I used to visualize comic strips on newspapers, and that was one of the ways that makes you different. I think one of the key ways here is that when you want to stand out in a community, we need to think of some effective ways that it's easily shareable, like GIFs, or communicating a story that other than just using a video or using more infographics, and communicating it via a storyline, like a comic strip, a simple idea, would go a long way. And I think also on the right hand side of the screen, you can tell storytelling with scenarios is actually so important. When you talk about your daily activities of going to the supermarket or going to a fast food chain store or meeting other people in the park, like when you talk through it, like what is the right thing to do and what isn't the right thing to do. These are some various ways that we can highlight to other vulnerable populations within our communities about what is the right thing to do. How do you protect yourself against the COVID-19 virus? So now let me just quickly share my secret, our secret about how we did this, which is our 6 R's. So our 6 R's goes with the first R. I'll go through the 6 R's and I'll go over what and elaborate a bit more on it. So the 6 R's are recognizing problems. So I'll go over it in a bit. So first R is recognize, second R is research, third R is relate, fourth R is relevance, fifth R is resolution, and the sixth R is reflection. So you might hear of other frameworks and other models, but this is the 6 R's that we use a lot at More Vulnerable. And let me quickly elaborate on what these are. So we need to recognize a problem recognize problems or issues within our community. So for instance, like the case I was mentioning earlier, misinformation. So that was a problem. So we need to research, we need to identify challenges, we need to identify who our audience are, and we need to know what we're saying effectively. We need to come from a right source, be it WHO, be it from UNESCO, be it other stakeholders that are producing all this really good information. And then we need to relate, we need to understand why this is happening. There might be some cultural perspectives at play here, and we need to be able to understand. And then the third and fourth point, so relating and relevance, these are very similar points, because once you're able to relate to why this is happening, now you need to make it relevant to the community so that they will be able to support this message, because they're able to relate, and they will think that, look, this is relevant and this needs to be heard now. And then on to my next few points will be about resolution. So resolution is actually about solution, about really driving that impact. So now when you done all the research and recognizing all the problems and make it relevant, the solution is also key, because when you work on a problem and you found a solution to it, but sometimes I find ourselves also forgetting what our purpose was. Why did we start this in the first place? You start to lose relevance in all this, and that's the reason why focusing on remembering your purpose is also important. And now the last part of it is reflection. You need to evaluate what happened and embrace any mistakes that happen or any failures in the process of doing so, because recognizing these mistakes and failures, at least now we know what doesn't work, and we are at least one step closer in making things work. So now, to conclude my sharing very quickly, as COVID-19 has affected us all and highlighted various key issues within our society, recognizing the importance of vulnerable and marginalized groups, communities, and populations to COVID-19, our work for this must not wait. More than ever, if we want to effectively engage communities, I must encourage working with and supporting young people. I am certain and I believe that there are other like-minded individuals like myself who will be more than happy to support stakeholders in mobilizing other young people. Hence, I would like to emphasize once more the need for us to value solidarity and collaboration, as this will ultimately help us to enable greater reach within our own communities. And may MOVAN virus be a symbol of hope for everyone during and beyond this COVID-19 pandemic crisis, as our movement since the beginning of the pandemic has shown that even in one of the greatest healthcare crises of all time, with many countries going to lockdown earlier this year, we were still able to unite youth globally in our movement. Thank you.
Ian, thank you so much. That was really great to hear from you. And your secret, the 6 R's, I think we're going to learn that I've written carefully. Just to stress the relate and the presentations. Just really, really amazing, and what you've been doing is fantastic. So I'm going to hand over to Emily now, who's going to facilitate the deep dive. Thanks.
Thank you, Catherine. Hi, everyone. This is Emily Ramos from UNICEF. And the next part of our program is to do a deep dive discussion. And for the deep dive, we've thought of 3 main questions that we would like to reflect on. If we can have that in the next slide, please. So for the first question, we wanted to talk about, when keeping in mind some of the lessons learned from the COVID-19 pandemic and the response, how can we ensure affected communities are engaged at the onset of an emergency and are given the space to contribute to the response? And in relation to that, how can we address some of the challenges raised by the speakers? So what I'm going to do, I think, is first see if anyone on the panel would like to address this question. And while they are answering that, if any of our participants would like to chime in, please raise your hand and I will give you speaking privileges. And that way we can have you speak as well. So I guess from our panelists, does anyone want to start? Maybe Marilyn? Yes.
Yeah, sure. Our community, especially like refugees and migrant community setting, can be very different because now that we are under conditional movement control order, CMCO, so our community officers, and a little bit of the background and information about our refugee situation in Malaysia is that Malaysia is not a signatory to Refugee Convention, and our movement is closely monitored. So when it's come to addressing this emergency onset cases, we, for my community, based on my community, we are providing a 24-hour hotlines that someone is always picking up the cases. And then since we cannot personally move around to assist the community member, we are also having like a site coordinator from in different areas, so that these site coordinators will bring up the case and we respond to the cases accordingly by connecting the case or the person or the member with NGOs that be able to help and assist them in a better way.
Thank you very much, Madam. Those are some great ideas to make sure we are connected to the communities. I believe, Ian, would you like to jump in here?
Definitely. I see a couple of questions from Noreen, and I hope that I'll try and address some of these challenges and also hopefully also answer some of Noreen's questions. And also, so to begin with, let me start with answering Noreen's questions, if that's okay. So Noreen's question was, is stigma still an issue? If yes, how can we support to make sure that community engagement takes care of this issue? What would be the best way to approach this? Stigma is indeed, I believe, still an issue. I mean, my way of recognizing this as still being an issue is reading through the news, because I still see it. If I can still see it happening, then I still recognize it as an issue. And what are some of the ways that we can enhance our community engagement on this is actually instead of just raising awareness, because I see a lot of people raising awareness about things, but then the problem, the existing problem that's happening is actually how do we actually engage actions, and how do we, and that's one of the ways that I think it's important. So be it initiating conversations, or be it getting people involved to initiate those conversations about it is important, just as important. And for instance, one of the key ways that I was trying to mention earlier in my sharing was about using the filters. So there are many different ways, be it as what Marilyn was saying, having a 24-hour hotline to get people to speak to. This is some ways of getting people involved, but many a time, when we try and find the balance between raising awareness and driving actions, it's very difficult to find that balance. And even in our movement, we also find it a bit difficult. But this is something that I would like to address, and it's something that at least we can all work on together after recognizing this issue. And Noreen's other question: how do we prioritize which issue to address first, and what more needs to be done moving into next year? Well, this in itself is a difficult question, and I believe would help to address the first question there about what some of the challenges raised by the other speakers. So going to next year, I believe that this whole idea about mental health support needs to be addressed, because mental health is something that basically has been an ongoing problem, existing problem since the beginning of the pandemic. If you're talking about different places going to lockdown, or if you're talking about stigma, this is mental health will continue to be an issue, existing in these different communities. And some of us here, I believe, since we're all involved in such in this work already, I think we know the right thing to say, we know the right thing to do. But I think what we need to work on going to next year is actually how do we have more of such community engagement. And for me, I think on behalf of More Vulnerable, prioritizing mental health support, and as what Marilyn mentioned, psychosocial support is one of the priority that we should have going to next year, because I believe the virus is here to stay, or hopefully the vaccine would help to address some of this, but then I believe mental health will still be an ongoing existing issue that we'll have to address.
Thank you so much. And yes, we may have a vaccine for the virus eventually, but yes, I agree, the mental health issues are things that we will have to deal with for a long time. That's a very good point. I see Ms. Asma, you raised your hand. Would you like to input? And then Mrs. Rafa after that.
qayb bulshada qaybteeda nugul ah oo aan ka barakacayaasha qanuunka kuwaasoo aan la maqal codkooda iyo bulshada qaybaheeda kale ee wax haysta. Haddaba bulshada codkeeda aan la maqal ee ku sugan barakacayaasha waxay u baahan yihiin inay helaan wacyigelino badan si uga taxadiraan waxyeelooyinka coronavirus.
Yes, as I say, according to the Somali context, people, communities are different categories. So displaced people in Somalia are actually very different to the other people. And actually they are not access to social media, TVs, and even sometimes the radios. So many information regarding the pandemic is not actually available, and they didn't actually receive an information regarding more on that. So my recommendation is address the challenges. We should, people should be actually approaching IDP settlement. People should go, and people providing this information and awareness raising campaigns should be should go to the IDP settlement, and people's capacity should be capacitated. Information and leaflet is translated in Somali language to distribute to different places. Though majority of them can't read, and even Somali language. However, instructions regarding that are very important. If in the IDP settlement, a center people that can watch videos, something like this can be installed, is also very important, because the majority of IDP houses, there's no TV, there's no internet, there's no media. So most of them, this information is like something. Thank
Thank you very much for that input. Yes, very important to remember that some people have these access challenges, and we need to keep that in mind and address that. And I see Mrs. Refa, you wanted to jump in as well.
Yeah, actually, I wanna say that actually people, migrants and refugees here in Egypt suffer from stigma in society, and I think by how we can include them in the response for the COVID-19, I think we have to provide them what they need mentally and medically to be able to help themselves and help others. Moreover, I think they also need to we also need to improve our services to try to fulfill their needs and to solve their problems, to be able to cope with the current situation. And actually by we, I mean companies, organizations, and the NGOs, and etc. And also the government will gonna have an important role in this process. And that's it. Thank you.
Perfect. Thank you very much. I see a question came in through the chat. In a complicated, conservative, traditional society where percentage of people complying with health practices is low for different reasons, but not because of awareness, what is the best approach to follow to overcome this challenge? I wonder if any of our panelists have a comment on that. And also at this point, colleagues who are in the participants, please feel free to raise your hand if you would also like to comment. This is meant to be a deep dive discussion with all of the attendees. So we would love to hear from you as well. I guess we don't have thoughts on that question as of yet.
Actually, Emily, can I jump in on this one?
Yeah, go ahead.
Because actually it came, sorry, someone's asked to repeat the question, and I can repeat it again. In a complicated, conservative, traditional society where percentage of people complying with health practices is low for different reasons, but not awareness, what is the best approach to follow to overcome the challenge? And I just actually wanted to reflect back on something that Asma had shared with us, and it was, unfortunately, maybe was challenging to pick up exactly some of the translation. The sound was a little bit challenging, but she talked a little bit about some of the problems that they faced in the IDP camp in Jamale. And one of them that she talked about to me, I don't know if she mentioned it today, was that she was telling people to wash hands, but there wasn't enough water to wash hands. And so that's one of the reasons, maybe, it's not necessarily related to conservative traditional society, but it was one of the reasons they weren't able to really comply with health practices. And they fed back to the humanitarian community. And I believe one of the NGOs was able to give them more water to do that. Asma, did you want to share anything else on that? Maybe not. I've put her on the spot.
I see though Ian has raised his hand as well.
Sorry. When that question was mentioned, I was cutting in and out, but I didn't really catch that. But at least now I see the question in the chat now, so I can hopefully try and say something in a really short time. For this question, actually, this is actually an existing problem that we face as well at Mobile Virus. Being efforts of young people trying to support various messages, and how do we address to our other young people about, look, why are they locking down again? People are actually fatigued of even listening to us, because we talk about COVID-19 to an extent that people are tired of listening to us. So and for instance, in this question where the question is about what percentage of people complying with health practices for different reasons in a conservative traditional society. So my response to that is really, since identifying that this is really an issue, to encourage conversations about it. Because when more than one speak up about that issue, that would, help to hopefully break that stigma, that complication, that difficult topic, because that's when we can effectively address the issue. Because sometimes when you raise awareness about it, there's really, in our opinion, at More Vulnerable, there isn't really anything really effectively being done. But we would definitely encourage to initiate those conversations, because if you can band with one or two other people who agree that this is an issue that we can effectively address, then start speaking out about it, and speaking up to one other person. Doesn't necessarily have to be social media if it's something sensitive, but speaking out to different people around you, and that's where you start having conversation. That's where you start having more people aware of this indirectly, because I know that this in itself is a difficult question. I hope I can help to address that in my response.
Thank you. And I see our colleague from UNICEF, Arunima, has raised her hand. Arunima, I've given you speaking rights, so if you can unmute yourself.
Great, thanks, Emily, and hi, good afternoon, everyone. My name is Arunima, and I'm from the Iraq Country Office as the Chief of Communication for Development. Well, I think, and it's a very important question that has been raised by our colleagues, and what comes to my mind is, one of the things is that I think it's very crucial that we really need to build the trust of our communities and in the healthcare services. I know it's very easy when I say that, but I think that's where effective communication channels and materials come in place, and engaging with the communities on a very rigorous basis. And when I say rigorous basis, I mean that it has to go beyond messaging. So it's not only just about top-down messaging, but it's also about a positive dialogue with our communities. And I think in this light, accountability to affected populations, and I think that is something that we all really need to understand, is we need to keep the community at the center of our programming, and listening to their concerns, listening to the feedback, their complaints and queries, and then packaging it and repackaging it into positive communication and messages might be very helpful for communities who have lost trust, or who do not follow the regular, or there's a lack of interest or willingness to access healthcare services. And I think this is a very clear example where we do see it in COVID as well. We're experiencing this in countries where people have lost faith, do not have trust in the healthcare services. And especially in Iraq, as an example I would like to give, is we're focusing a lot on rumor tracking. And that is something that is really helping us build the trust of the communities. So it's literally real-time tracking of rumors and misinformation, and then sending it out to the communities and engaging community stakeholders, for example, religious leaders, teachers, women-headed households, who are actually the agents of change, and even adolescents as for that matter. So I just wanted to come in and just give my thoughts over from my side, Emily. Thank you for giving me the floor.
Thank you very much, Arunima. Great points. I see also some great points coming in from Ala through the chat. Would you like to come in? You do have speaking privileges as well, so you can unmute yourself.
Hi, thanks everyone. This is Ala from UNODC. The important point here really is that the information should be to empower the local community, and to empower you need to have a sense of confidence in where your information is coming from. So working with families, with people in the community right from the onset to, even piloting the information, how useful is this information to you? How clear is it? Is it culturally acceptable? Are there any conflicts? And really working to make sure before you kind of spread the information on a really wide basis, that actually families will find this acceptable. Thank you.
Thank you so much. At this point, I think I would like to transition to question number 2, if we can, on the slide, please. And I think Ian already touched on this a little bit. How can we address the competing needs of protection against COVID and the secondary impacts of COVID? And some of the secondary impacts that we have touched on would be issues on stigma and issues on psychosocial support. These are all very present, and you can't address just COVID without thinking of all of these other things. So we would welcome your thoughts on how you think we could address all of these competing needs. I wonder if, Ian, I know you spoke to this earlier. I don't know if you want to add a little bit more.
Um, it, if if we're not in the interest of time, I'm okay with elaborating a bit more on this. Can I give the floor to other speakers first? Because I think I don't want to be speaking all the time. I definitely.
Okay, perfect. Thank you. Yeah, so we do have our colleague Ahmed who raised their hand. Are you able to unmute yourself?
Yeah, I'm able to unmute myself. Thanks a lot. My name is Ahmed and I'm from World Vision in Georgia. Addressing the competing needs of protection against COVID, I think the most important thing is that we need is the community leaders through the refugees, among the refugees and the IDPs as well. Because here, like what we did here is that we recruited some community leaders, and those community leaders, like it was at the beginning, it was very hard and difficult to reach out all the communities, especially in the psychosocial things. And this is the most important thing on the COVID effects, because the protection that most of the communities, I mean, majority of the communities is the psychosocial support, because financial support might be covered somehow, and the most important, the most huge challenge the communities was facing was losing jobs and losing the source of income. But the psychosocial, as Ian mentioned at the beginning, is the most important thing, because the thing in the mental, it's like really hard to solve that. And I think the community leaders should be involved and be taking part in giving protection out of this. Thanks.
Thank you very much, Ahmed. And Noreen, I believe you wanted to jump in as well.
Thanks, Emily. Thanks, everyone. This is to me is really important question, because this is where we really need to go a little bit deeper and understand the socioeconomic impact and the implication of all these issues. I think that Ian already elaborated on, there is a need of more psychosocial support for looking at next year. What should be our vision for next year? What should be the priority for next year? And while we say that stigma still remains an issue, and it is not just among the vulnerable populations, but across the board, across the globe, this remains one of the key challenges that we are all facing, and we are still trying to figure out how to really make sure that we reduce the effects of stigma in terms of, for example, giving you a real example from some countries in Africa where the health workers are seen as the people who spread the disease rather than who are trying to prevent it. So as a result, the communities refuse to go to the health facilities and get the health services. So there is an implication on that there is low immunization coverage now. So just to say that working with, as Arunima and Ala said, that working with local influencer remains the key if we really want to address the issue of stigma, and also providing more psychosocial support, because one side of this is technical, which all of us do. But then the other side is who is going to actually do it at the community level? Who is going to take ownership of these at the community level? And unless and until we engage with the influencers, those people who influence the community members, could be religious people, could be traditional or local leaders, anybody who has some kind of influence on people's opinions and behaviors, we need to be engaged with those people. So just my reflection. Over to you.
Thanks, Noreen. And I think Sarah and Rafa, you would like to speak as well.
Yes, actually, we faced a big problem during the first wave of the pandemic, that refugees and migrants here in Egypt don't have the priority to enter the hospitals or the governmental hospitals to if they got COVID-19 or got coronavirus, and it was a big problem for them. Besides, they faced a lot of problems. Some of them lost their jobs, and the other part actually they doesn't have jobs to lose already at the first aspect. So actually we are, as Soriana, we tried actually, and we are still trying to help them medically by the help of the IOM here in Egypt. We, as Rifat told you before earlier today, that we made a referral system between us and the IOM to help the migrant and refugees to if they got any medical issues, coronavirus or any other type of illness. Actually, they helped us well to achieve this goal. On the other hand, actually, the food baskets and the support in this phase actually helped us as Soriana and helped the communities, the community here in Egypt, especially in Alexandria. We collect a lot of feedbacks of the effect of COVID-19 on them, and how many people got corona from this community. And actually the result was really depressed us. And actually we are hoping to that this phase end as soon as possible, and everyone live a normal life again as we used to. Thank you.
Thank you very much. And I just wanted to check, I see Arunima, your hand is up. I'm wondering if you wanted to speak to this question as well, or if that was left over from the previous question.
Yeah, it's just my mistake. Apologies.
Oh, no worries at all. Just wanted to check. Yes, so in the interest of time, I know we could talk about this second question for a very long time. There's so many competing needs that need to be addressed. But I think let's move on to question 3. And that is, how can we ensure inclusion of all members of affected communities? So including women, girls, boys, and persons with disabilities. Sarah and Rafa. Oh, sorry, go ahead. Who was that?
So whoever wants to speak first can speak first. I didn't mind jumping in on this.
Oh, sure. I was just wanting to check if Sarah and Rafa had their hand up for this question or the previous one, but they lowered it. So I guess, Ian, the floor is yours.
Right, thank you. Very quickly on this, many times, like, webinars, a lot of times, I think Zoom enables this function of translation. So I think for, to begin with, on a community level, before we talk about so enabling translation, I think is one of a simple way of including other members of affected communities. Another way is actually having people with visual or hearing disabilities. I think we can have translations for that as well. And I think that's one other way that we can effectively enable greater inclusivity of members of affected community. Because I think I cannot imagine how it would be like to be in their position, not knowing what's going on around them if they're not being included in this conversation and knowledge of how to protect themselves from the coronavirus, for the very least.
And also just to add in a little bit, that including everyone, it's really important where you have to create more programs that is a bit flexible and lighter, not into too intense and too detailed that they because currently many people have plenty of time in their hands, so we have to create more sections and program online for them to participate with very basic exercise sessions or something that they can, something like a reading section or something a lot more flexible so that they can all be included. But unfortunately for community refugees community in Malaysia, there's no services and very limited services for disability. So I don't know, and we are still figuring out how to help those disabled community, even though local NGOs and international NGOs are trying their best to come up with different support, but it's coming down to the recognition of the status is one of the problems that we are facing now. So yes, that would be my suggestion to make more girls, boys, women, and everyone in the community to be included in the program.
Thank you very much, Marilyn. And I think Ms. Asma, your hand is up as well. We'll take your final answer and then we'll wrap up after that.
waxaa lagu wada qayb gelin karaa wacyigelinta bulshada noocyadeeda kala duwan iyadoo la sameeyo group ay ka kooban yihiin raggii dumarkii iyo dhalinyartii kadibna groupkaasi wacyigelintay sameynayaan ay noqoto inay bulshada markay wacyigelintu sameynayaan inay guriguri u raacaan.
Yes, he's answering to this question. Actually creating inclusive community groups, community engagement and awareness groups that are including women, youth, men, everything. Those who later on do a door-to-door campaign in the community it can be a way that can be engaged with all of the community members.
Perfect. Thank you very much, colleagues, for a very interesting discussion. Unfortunately, we have to wrap up, so I'd like to turn it over now to our colleague Carlos for some final thoughts.
Yes, thank you very much. I'm trying to share my, just cannot start. Okay, good. Thank you very much. This was really, really great presentation, great panel. So now I need to wrap up, and I don't know if I can be fair, because many nice and very great things were said, and I don't know if I captured all of them. Basically, some takeaways that we need to take into consideration is things that were discussed. Well, basically the importance of mental health of the community members, also the importance of the mental health of the health providers or the community facilitators. We need also to check on that all the time in terms of psychosocial support and provide a lot of resources specifically to the mental condition. And why? Well, also because COVID-19 is not the only enemy, but we know that also the population, specifically migrants, displaced populations, refugees, have big loads of fear, are under a lot of stigma. They feel a lot of frustration. So basically, it's very, very important to think in that psychosocial part, the mental part. And also, it was said that it is very important to have sustainable programs. And I would say that the only way to be sustainable is by creating capacities locally. So the only way to do it is through community engagement. This is the importance. And sometimes in the humanitarian side, we don't do that enough, that community engagement. And then this is what happens, that later on the support just goes away and the need stays there. So it's very, very important in terms of sustainability to have good community engagement. It was said also the importance of prioritizing in basic needs. Also sometimes from the humanitarian side, we come with these big packages with our own interest in providing information or providing what we want to provide. And sometimes we forget that people have priorities also. So shelter, food, health, blankets, non-food items, all of those are also very, very important in our approach. And we need also to prioritize in that. And then also the importance of knowing the community. I think that was said many times. Challenging times, yes, we are now, all of the world is basically under a lot of stress with the virus and with all the conditions. it was said that how to keep them connected to each other. So this is very nice because this is not just a thought of me as UN agency, connecting to the community. No, but also us as UN agencies connecting different groups that work together within the community. So this is like a big, many pieces that need to work together. And I love that phrase. Also being effective in terms of advocacy efforts. So this is not necessarily about quantity, sometimes we come from outside with a lot of activities and we want to have the best program in terms of numbers, a lot of activity. But no, that is not the idea. It's better, the quality is what we need to look at. So it's not about activities, it's not about outcomes specifically, to work with more detail, to specifically know exactly how things need to change in that environment to improve the health or to protect the community. We also need to adapt to the resources available. So sometimes we come with ideas, innovative ideas, but what happens when there is no access to telephones, no access to internet? So definitely the resources need to be very specific and very important to always consider mobility, because mobility is part of the context, also needs to be part of the approach. So we need to think that communities are not there in that place only. They come from another community, they will to another place, they were displaced from certain communities. I mean, the whole cycle, the whole mobility migration cycle is important to consider. And very good to build the trust, the community in the center of our programming that was said also. So 5 action points very, very quickly. Participatory approach, very important to work with community leaders, with religious leaders, with community health workers. Youth as the most effective, I would say, resource for community engagement. So it's important to make them part of the team. And also said that more than happy in mobilizing other young people. So a young person will mobilize a big group of young people, and this will make team even bigger and more effective. Also, the importance of the language and cultural adjustments. This information happens because people don't necessarily speak English, and this is very true. It seems very obvious, but no. I mean, sometimes we come with very nice guidelines, very nice things, but not really adjusted to the population. And this is not just about language. It is also about the complexity of the message. To do it in a creative way. Comic strips, I don't know, drawings, different activities. A simple messaging is always more effective. So this is very, very important and was said in all of the presentations. The third one is to use innovative approaches. So basically social media to let the community define the best approach and the importance of assuming those challenges. So now it was said also that the switch all the operations to online. And this is also important now at this stage when we are finally seeing some sort of light there down the tunnel, and thinking how we are going to really adjust our approach when the virus starts to stabilize. How are we going to implement an hybrid approach, between face-to-face, but also about this type of mechanisms online. Keep always the positive messages, keep them always there. So empower communities, be a symbol of hope. This is very important. Try to avoid this negative feeling or fear, create more fear, create more stigma, and work directly to empower the community. And then, as we said initially, to build capacity in the community, to move from that humanitarian approach to the development, really think in terms of how are we going to create things that will stay in the community. And to finalize, basically, Ian's 6 R's, they are right there, so I'm not going to read them, but I think they are really, really nice, really good input for all of us to have this in mind all the time that we are working with the communities. And I think that the final big message is to learn together, define needs together, define actions together, work together, improve together, and finally smile together and be happy together as a community, as a society. So great panel. Thank you very much to all of you. It was really, really interesting. Thank you so much for your support.
Thanks to everyone. I hope everyone has a good evening or good rest of the day. And really thank you for joining us, and a big thank you to the 4 panelists. It was really great to hear from you all. Thank you. Carlos, wonderful wrap up. Thanks.
Thank you.
Thanks, everyone. Thanks, Carlos and Catherine
Thank you.
also. Wonderful.
everyone.
Thank you very much.
Thank you, everybody.
Thank you all.